The first measurement we're going to take is shoulder flexion. And as you'll see in your book, the norm is 150 to 180. Now, it would be optimal if we were able to meet with each of our patients prior to surgery so we could see what their true norm is, but most of the time that's not going to be the case. So the best case situation is we compare the affected side to the unaffected side. Now, in Edie's case, we have two affected sides. One had a modified radical mastectomy, the other a simple mastectomy. So what we can do is we can compare one against the other, but we have no real true norm to compare to. Whereas if we had met with her prior to the surgeries, perhaps I would be able to have a baseline measurement. So in any case, the axis of rotation in this particular measurement is going to be at the shoulder joint. Now, the easiest way to obtain this is to just bring their arm out ever so slightly, and you'll find an indentation essentially between where the humerus goes into the shoulder girdle. Now, you don't have to be perfect, but you want to try and get the same measurement each time. And this is not something that we take the best of three, because with each movement, the person is going to gain range of motion. So it's really important that when you're doing these, that you explain to your client that they must stay in the plane of motion. So I describe two panes of glass, and I'll guide Edie's arm as well, but she must stay within these two panes of glass, because as soon as she moves out to the side, for example, I can be doing flexion. As soon as my arm goes out to the side, that's not true flexion anymore. Now we're looking at partial abduction, and so the measurement is not going to be a true measurement. That may in fact limit their range of motion, and that's fine, because we don't care what the norms are. It's the norm for Edie that I care about, and what I want to see is an improvement, so that 3 months from now, if I take these measurements again, even if she's only improved 10 degrees, it's still an improvement, so that I can gauge whether the exercises and stretches, range of motion exercises that I'm having her do are paying off. So what I'm going to do, I will come over here and I will find this spot right here, and then I'm going to line up my goniometer. Now, you don't have to place it right up against their arm, or it will inhibit the movement. So because I know I'm going up and back, I can get the movement arm out of the way to begin with. And then I want the stationary arm to remain parallel, in this case, to the table. And this is never going to move. Now, if it does move, it's not a big deal to just return it to starting position. I just have to have it horizontal. So I'm going to hold this there. I'm going to make sure that Edie is looking straight up at the ceiling. People have a tendency to want to watch their arm in motion, and that's not going to help. So they should be in neutral, knees bent, which keeps them from arching their back. And there's going to be some scapular movement, but we want to minimize it. So you are looking for any movement in the lower back and scapula as their arm goes through any particular plane of motion. So with her palm facing her body and her thumb pointing towards the ceiling, I'm going to have her raise her arm up overhead, reminding her that she should stop at the first indication of discomfort, not pain, but discomfort. We don't want people pushing through pain here. So go ahead and raise your arm up. She can keep a slight bend in the elbow, but we want to maintain a pretty straight arm unless it's impossible. And go ahead, and you want it to be slow and deliberate. Go back as far as you can. Now I'm just going to move this for a second so you can watch and see here that we have no movement in the back or the shoulder girdle. Can you go any further, Edie? Okay, now if I detect that she's struggling, I'm going to say just hold that there. I'm going to come back simply because I know where this was. I'm going to get my stationary arm where it was. I'm going to take the movement arm to her elbow, and it's going to be to the middle, because if I go to one side or the other, my measurement might vary by 10 degrees. So as soon as I have this, I'm going to let Edie lower her arm so she's not sitting there in pain. And then what I'm going to do is I'm going to look at my measurement. Remember I said we were going to use the middle numbers. So I'm going to look here, and it says 104 degrees. I already said to you that the norm is 150 to 180. Before I would have Edie do anything in shoulder flexion using any type of resistance, so this could be a Pilates reformer, this could be dumbbells, bands. It could even be holding a yoga pose with her shoulder in flexion. I'm not going to do that until she has at least 90% of the bottom number, which means 90% of 150. So she needs to have at least 135 degrees of motion before adding resistance. Right now, she's only 110. So range of motion exercises and stretches take precedence before anything else. Because if I give her resistance now, she's never going to get any better than 110 degrees. She will just become stronger in that plane of motion. Okay, the next measurement is abduction, and just like flexion, the norm is 150 to 180. This movement is like a snow angel, so they're going out to the side. But what you need to watch for, in addition to arching of the back or excessive scapular motion, is that their humerus should not come off of the table or floor wherever you're taking the measurement, because once again, then we're going out of abduction into flexion. It's the exact opposite of the example I gave you before. So the axis of rotation here, I'm going to make sure that my movement arm is on the top. As I mentioned, you can very easily do it backwards. The stationary arm is in line with her body. The axis of rotation is at the armpit. Now, bear in mind that after someone's undergone a mastectomy, they're probably going to be a little self-conscious, if not a lot, about their body. So I try and maintain my space, and I just gauge where the armpit is. I don't actually have to poke around. And I hover above them. I'm not compressing this onto their chest. So the axis of rotation is at the armpit. The stationary arm is in line with the body. Now the movement arm will follow her arm as she moves. So once again, I'm going to remind Edie to look up at the ceiling. In this case, her palm is upward, and I'm making sure that her upper arm maintains contact with this table throughout the whole range of motion. So go ahead. Now your pane of glass is here, between here and the table. So bring it up towards your shoulder, or towards your ear, excuse me, without raising your arm off the table. Just keep moving. Try and keep your arm as straight as you can. The other thing that you may notice is some people will tend to rotate, and you don't want that either. So keep your arms straight. Her head should be pointing straight up, and you also want to make sure they're not tilting their ear to their shoulder. You can go further than that. Keep going. Okay, so at that point, Edie started cringing. That was a pretty good indication for me that that was as far as she could go. Now, even though her arm appears to be further up, I'm still only taking the measurement to the elbow joint. The stationary arm is in line with the body. I'm going straight down the upper arm here, and then let's get her out of pain as quickly as possible and let her relax. So that particular motion, she is 82 degrees. Norm is 150 to 180. Now think about this. Following a mastectomy, following reconstruction, following an axillary node dissection, imagine how much scar tissue and possible adhesions are in the chest wall that can inhibit that motion. Same thing with flexion. You've got all of this pulling here, keeping her from being able to move her arm. Now her surgeries, the first of which was 35 years ago, the second of which was about 20 years ago, a lot of time has passed. And although she's gone through intermittent physical therapy, without continuing to do these exercises on a regular basis, usually there will be some compromise in range of motion, or there may be some loss, even if they had achieved full range of motion at one point. Next measurement we're going to take is external rotation. The norm is 70 to 90. So I'm going to ask you once again to think about what it must be like to rotate against that scar tissue and adhesion going backwards, and how difficult and painful that motion can be. Not only are we dealing with people with breast cancer with these motions, but it might be an athlete. It could be a baseball player, a basketball player, young or old, and maybe they have different reasons that their arm isn't moving normally through the plane of motion. But this gives us a way to gauge their starting point as well as any improvement. So it can be used for sports-specific purposes as well. So for external rotation, I also find this very handy if you have pockets that you can put your goniometer in. you're going to bring their arm out so there is a 90-degree bend at the elbow, and it should be, the upper arm should be just below shoulder height. So realize that at that 90-degree point, that is where shoulder impingement occurs. So we want to release that just a little bit. Now the axis of rotation here changes, and it's actually going to be at the elbow. The stationary arm in this particular case is going to be lined up with the arm to begin with. So this is our starting position. The stationary arm is in line with the arm. The axis of rotation is at the elbow. And as Edie goes backward, I need to make sure that this 90-degree angle here at her elbow joint is maintained. I'm also going to watch, again, that there is not excessive movement in her lower back or in her scapula area. Now, obviously, she has a jacket on. It's cold. She's covered up. My visual isn't as good as if somebody were wearing a tank top or tighter fitting clothing, but most people following surgery are not going to feel comfortable disrobing to any great lengths. So whatever works for that person, the most important thing is that they're mentally and physically comfortable with the situation. So axis of rotation is set, stationary arm is in alignment, and then I'm just kind of moving this out of the way because I know my direction of movement is going this way. And I'm going to make sure she's looking up at the ceiling, and when she is ready, I will have her go ahead back as far as she can without pain. So go ahead. Just keep it a fluid motion. Keep going. Are you feeling any pain through the chest?
Yeah.
Okay. So at that point, I'm going to make sure that this is still going straight up and down. My movement arm is going right to the epiphyses of the wrist. And I want to make sure this is still vertical. Then my first thing is to let her relax so that I can then look at the measurement. And as I mentioned, the norm is 70 to 90. She is at 40. So the bare minimum would be 63 degrees before I would have her doing any external rotation with resistance. So as you can see so far, with flexion, abduction, and external rotation, Edie is not ready for weights or any type of resistance. My focus is going to be entirely on range of motion and stretching until we can get those numbers up. The next measurement we're going to take is internal rotation. Now, with somebody who's had breast cancer, and I want to reiterate that these aren't just for people who've had breast cancer, but we are going to see a lot of them. However, in this case, we're going toward the surgery scar tissue adhesion, so oftentimes their internal rotation is not affected negatively unless, of course, they had a latissimus flap reconstruction where they also have an incision here, which would inhibit that forward motion. But this is not the case with Edie, so I can expect that she'll probably be within normal ranges. Now, our stationary arm, our movement arm, our axis of rotation are all starting in the same position on this one, which is going to be with the arm out here at just below shoulder height, elbow at 90 degrees. Now, I'm going to switch sides here because I've got a little kink in my plan. In this particular case, I have to actually own 3 arms, which of course is not a possibility. The good news is this is a really easy point to remember. So even if I put my goniometer down, I can very easily come back to that because the elbow joint is not going to change. And as long as you know what a straight line is up to the ceiling, we can always come back here. So what I'm going to do is I'm going to very gently place my hand on her shoulder. Now, when I say gently, I mean gently because anyone who's at risk of lymphedema, who's had lymph nodes removed or irradiated, I don't want to compress that area, not to mention the fact that I don't want to cause her any pain. So if her shoulder starts to lift up or roll forward, I'm not getting a true reading of her range of motion. So I keep my hand gently here, have her go forward, and then I start to feel that motion under my fingertips. So I say, Edie, hold that for a second. I come back here with my axis of rotation. My starting position was straight up and down. I take my movement arm to the epiphyses of the wrist. We're just going in the opposite direction. I'll allow Edie to rest. And then I can look here. And in this particular case, the norm is 40 to 60 and she's at 50. So this is the first one that she is within what we consider 90% of that lowest number. And so if I wanted to do strength training in internal rotation, if I felt that that would benefit, then I could go ahead and do so because she's 90% or better. So I've had Edie switch sides so that her left arm was on top, which is the one that I'm going to continue measuring. So this last measurement is shoulder extension. The norm is 40 to 60, just like internal rotation, and it is listed in your book. The axis of rotation, however, is going back to the same place that we used for flexion. So I'm going to find that soft spot there between the humerus and the shoulder girdle. She's going to start with her arm facing her body, palms facing the body. The axis of rotation is at the shoulder joint. The stationary arm is in line with her body. Now, I've put this under her head so that she doesn't have any discomfort, as best as we can control, under her neck, and she must maintain a straight line from the top of her head to the tailbone. We don't want to see the trapezius engaging and elevating of the shoulder. We don't want to see her rolling forward or backward. So when you're ready, Edie, you're going to keep your arms straight and you're going to go backward without tightening up these muscles. Simply go toward that back motion. And I'm making sure, once again, that she stays in that plane between those two panes of glass. Okay, and then hold that there. I go to the epicondyles of the elbow, relax her arm, and I look at this, and it is 48 degrees. Norms are 40 to 60. So in internal rotation and shoulder extension, she does not have any limitations as far as having to continue doing range of motion because both of those planes of motion are satisfactory. I can continue to do stretches if I deem necessary or just want to include that so she doesn't get any worse. But I can start doing things like tricep press downs, arm extensions, shoulder extensions, tricep kickbacks, things that are in that plane of motion. So now I would go ahead and proceed to doing all of the same measurements on the other side. And in the back of your book, there is an assessment sheet in the back of Module 3 that you can actually fill in with all of these measurements. It gives you columns for left and right so that we can compare them when we're putting together the exercise program in the next module. Another thing that's really important to understand, and this is not 100% accurate one way or the other, but the majority of measurements that are taken while lying down are a function of flexibility and not strength. Therefore, if somebody cannot do these measurements, if they are limited lying down and it's flexibility, it makes no sense to take the measurements standing up, which would be a function of strength. Now, in the two that Edie was pretty good at, which was extension and internal rotation, if I want, I could take those measurements standing up, like so, and see if the range of motion is better or worse than it was lying down. Let's say it was worse, then that would indicate that those muscles need to be strengthened in those planes of motion. But the easiest way to do this is to just take the measurements lying down and know that if they do not have at least 90% of that bottom number, so 150 to 180, 40 to 60, 70 to 90, if they're not at 90%, they should not be doing any resistance or strength training in that particular plane of motion. So while Edie can do this, and Edie can do this, I don't want her using weights like this, or like this, or any other thing, a yoga pose, even Pilates reform, or anything that is going to be for strength training purposes. So all of this is explained in detail in your Module 3 handbook, and you can use this video to practice. You can also use the chart in the back of your book to do your own case studies or work with your actual clients.